Sedua with Dr. Wara, who has kindly and very generously given us some time to answer a few pre-prepared questions. Thank you very much for allowing us to interview you today.
You're welcome.
I have to say straight away, this is one very good-looking doctor.
Oh, thank you.
I'm sure any person would appreciate having a good-looking doctor to operate. So, can you introduce yourself just quickly and tell us maybe where you come from?
Thank you. So my name is Dr. Wara. So I'm a board-certified plastic surgeon, and I'm graduated from Udayana University in 2020.
Wow.
And I'm also pursued my subspecialty in craniomaxillofacial surgery in Japan, 2023. And right now I'm a consultant of the craniomaxillofacial surgeon. And after that, I joined BIMC Nusa Dua as one of the plastic surgeons team here, and we already do a lot of cosmetic procedures and also reconstructive surgery as a team here.
When you are involved with the cosmetic surgery, what would be the most common surgery that you might undertake? Maybe especially for Western people or Western women, maybe 50 plus?
Okay then. So basically, favorite one here is for the rejuvenation surgery. Yeah, usually like facelift, face and neck lift, and also blepharoplasty and body contouring. Yeah, like a tummy tuck and arm lift and thigh lift and all of the stuff like that.
What do you think is the cosmetic surgery that might have the best outcomes?
So I think it depends on the doctor, yeah, her preference. But for myself, if we do the rejuvenation surgery, because I think that it not change the person dramatically.
Yes.
Yeah,
yes.
but it reveal the best version of hers. And like a blepharoplasty, I think is the most. For me, is the patient look better.
Yes.
With the better version of her or himself. And yeah.
What's the age range on with patients that might come to see you? Is it quite varied?
I think actually it's quite varied. Yeah.
Yes.
Younger patient also come here.
Yes.
The most favorite one is a breast augmentation procedure.
Yes.
But I think the most patient come here around 40s, his 40s or 50s, usually to undergo like a facelift, face and neck lift, and also the lifting procedure.
Sure.
Yeah.
Do you think might be the right age, if there is the most ideal age in your experience?
Okay, in my experience, I think it starts from 40s, but it depends on the patient. So is it already there are like aging that already seen to the patient, maybe like a descent of his cheek, and also there is a jowl. Is there any skin laxity? It depends.
Yes.
So I think usually the most patient come in his or her 50s usually.
Yes. Yes.
So I think 40. If you start earlier, the result is more natural. Yeah, better.
In general, what sort of tests does BMIC require? Maybe for facelift, for example.
Okay.
Are there certain tests to be done before surgery?
Okay. Usually for the local, like a minor surgery, like with a local anesthesia, so like a blepharoplasty and like any other minor procedure. So we usually don't need a specific test. But if for the major surgery, usually for the facelift, because the patient need to be sedated with the general anesthesia, so the mandatory test requirement that needed before the surgery is usually the complete blood count, and also the coagulation studies, and also the basic metabolic test like a kidney function, liver function, and a blood sugar, and
Sure. And this might not be a question you can answer, it may be
Okay.
more for management, but can those tests happen in Australia or in America before people come, or do you prefer that those tests happen here?
So actually, if we first we have to consult it, we can do the teleconsultation first.
Yes,
Yeah.
yes, I see.
And
That's good.
we ask the patient if there are any specific disease or any kind particular disease that
Sure.
they have. If it is not, so we can suggest him if they can do it in their country.
Okay.
But it's the test result is validity is only up to 1 month only.
Of course, okay, because things can change.
Yeah.
And on that subject, is there anything in particular, any health condition that may be contraindicated
Okay.
for something like facelift surgery?
So so we have to check all the medical condition that patient have. Usually some condition is like we have to make sure is it safe to do the surgery before we perform it. So usually if we can check if the patient has a hypertension, so it's a
Yes.
controlled or not. So if the hypertension is controlled, we can pursue we can move to the surgery.
Sure.
And also, if the patient have a diabetes, so we
Yes.
have to make sure that their blood glucose is controlled, and also the patient with the cardiovascular disease. So we
Yes.
have to make sure that everything is good. His heart function is okay,
Yes.
and also with the thyroid disease. Sometimes we have to check his or the thyroid laboratory test.
Okay.
So make sure everything is safe for the patient.
So full disclosure from the patient during,
Yeah.
as you say, phone conversation or
Yeah.
teleconsult, maybe in Australia or
Yeah.
in the US, is very, very important.
Yeah, it's
Yes.
very important for us and also for the patient safety.
Of course. How long in general, say if we're talking some major surgery like facelift or abdominoplasty,
Tummy tuck.
or breast
Ah,
augmentation, how long would someone generally stay in the hospital after that surgery?
So actually for the major surgery, like the facelift, like a breast augmentation or tummy tuck, usually the patient stay for like 2 days after the operation.
2 days.
It just to make sure that everything is okay, everything is all right. There are no like everything is good. Yeah.
Excellent.
So after that, the patient can be discharged.
Great.
Yeah.
Excellent. So 2 days in luxury accommodation.
But some operation like mommy makeover. Like
Yes.
usually we perform like breast augmentation, breast lift, and also the tummy tuck procedure
Okay.
because it's quite a long procedure and it's quite complicated. So maybe 3 or 4 days.
Right.
But it's depend on the patient.
So if they're having the singular invasive surgery, so
Okay.
something under general, maybe facelift, how often would they come back to the hospital after the surgery is
Okay.
happened?
So actually, around 1 or 2 follow up.
Okay.
It depends on the patient.
Sure.
So actually, for the first follow up, usually we will perform like a wound care, so just check if everything is okay. But we also provided our medical staff can come to their accommodation.
Oh,
Yeah.
I didn't know that.
For the wound care.
That's good.
Yeah.
Oh my goodness, that's a very good
Yeah.
service.
And usually
Wow.
for the second follow up, usually around 7 until 10th day after the
Yes.
surgery for the removal of the stitches.
Okay.
Usually for the removal of the stitches for facelift and neck lift patient
Okay.
need
So,
to be removed.
so with the facelift, how long then would you recommend someone arrange to be in Bali?
So I think it's minimal for 7 days
7
after
days
the surgery.
And,
Yeah.
and you think flying home after stitches are removed is
Yeah.
okay?
I
no
think it's
problem?
okay.
Yeah, and I think if they have any problem, it's easy to follow up
Yeah.
at back home as well. How long do you think maybe for for major surgery in the abdominal area and even for face, how long do you think it is before the swelling really subsides?
Actually, the swelling is the normal process of the healing. Yeah. So some patient is quite afraid. Oh, I'm got swelling, but every procedure will get a swelling.
Yes.
Yeah. So usually the maximal swelling is around 2 or 3 days. Yeah. After that, it's gradually decrease, and usually decrease a lot in 3 or 4 weeks after the surgery. And usually for the final result until it's completely really subside, the swelling is around 3 or 6 months. Yeah. But in some procedures, maybe it can be up to 1 year. Yeah, it's like rhinoplasty, something.
Yes,
Yeah, right. There
yes.
is a.
Okay. Say we were having something like facelift or maybe breast augmentation or having breast surgery. Would you recommend that people after the surgery go have the hair treatment or have the laser
Okay.
or the Botox or filler?
Actually, I think it's the patient better to wait. Yeah, until the swelling it's clearly subside, and also the healing process is finished. So maybe it's depend also on the treatment that the patient want to choose. Maybe for the like hair coloring, you can start like it's earlier is okay, like 1 month.
Yes.
Or but for the laser treatment, I think it's need more time. Usually
Yes,
like 6 months, because it's quite. Sometimes if the patient is not healed well, the it can delay the process of the healing.
Would you recommend that people maybe stay maybe in their hotel while recovering?
I think in this patient to get to can get a maximum result is be patient. Okay.
Okay.
So I think it's better if the patient is have take a good rest. Yeah, especially for until 1 week after the surgery, after the removal of the stitches, because sometimes you must avoid like a very strenuous activity or exercise. Yeah. So, because sometimes it can make complication happen.
Sure.
Yeah, because like if you do a lot of activities, sometimes it can make like swelling is not decrease, and also there is increase of the risk of bleeding, of hematoma after the surgery.
Very good advice.
And especially for the alcohol drink. Yeah. So usually we advise for the patient 2 weeks after the surgery, you have to avoid the alcohol consumption.
To 2 weeks
After,
after.
and it's better if you can avoid it before the surgery also.
Okay.
A lot of patients come here also as a smokers. Because as we know, yeah, the smoking is bad for a wound healing, and it can delay the wound healing process, and also it can increase the risk of the complication. So we usually, if the patient before the surgery, we will ask the patient if do you smoke. So we can advise the patient maybe to stop the smoking is quite hard. Yeah, quite difficult. Maybe you can reduce the frequency of the smoking. I think it's the most optimal way is 2 weeks before the surgery and 2 weeks after the surgery.
What do you think some of the common mistakes are that people might make after having surgery? What's your advice?
So actually, so before the surgery, we explain also after the operation, we explain what is the instruction post-operatively to the patient until the patient can understand, and we ask is there any question or anything. So we also give the patient detailed instruction what we can do and what we cannot do. So basically, but sometimes, yeah, the patient maybe it's forget, and yeah. So usually, the instruction is used to maximize the result and increase the wound healing. So usually, for the specific type of operation like a facelift and breast augmentation, and also like after tummy tuck and like liposuction, usually we provide the patient with the compression garment. It is very important to reduce the swelling and decrease the risk of the hematoma. And sometimes patient is I don't want to use it. Yeah, sometimes yeah.
I know.
Yeah, the swelling is why my swelling is, yeah, why my swelling is not decrease, yeah, something like
Yeah.
that. And
Sure.
also some patient, yeah, because they are here also for a holiday. Sometimes I want to go for, yeah,
And
for,
it's hot,
yeah,
humid.
and also a lot of sweating, yeah,
Yes.
and a lot of activities. Sometimes, especially like in a major surgery, yeah, it can increase the risk of the bleeding and hematoma after the surgery.
Sometimes find that people have unrealistic expectations.
I think in this era of the social media is quite difficult. So they see like a lot of before and after photos of the surgery. Wow, it look amazing. Like, it's like a miracle.
It is, yes,
Yeah.
like their daughter.
Yeah. So some of
Yeah.
of our patients have their own unrealistic expectations. So they want to look like this one, but I think it's we as a doctor we have to, and also as the patient we have to make sure that our expectation is the same. I think it's better if you want to ask what is the best for yourself is to the doctor, the plastic surgeon. You have to consult it to the doctor, because some patient is consulted to the internet. Yeah, they ask the internet and the Google. So why I want to perform this procedure? So maybe, yeah, it's quite unrealistic expectation, because as you say that said earlier that it's depend on the patient condition. Yeah, so it's depend on the skin condition, and also like a facelift is depend on what type of what is your skin, laxity of the skin, and also is it there, is it the like a skin damage that cannot be repaired only with the facelift. So we have to really have the same expectancy.
Yes.
Yeah. We provided a teleconsultation here,
Okay.
usually with Zoom. So
And-
before the surgery, it's depend on the patient preference. If maybe some patient they cannot come here, so we can provide the teleconsultation. So
Excellent.
it based on the appointment
Sure.
for the patient.
And before surgery, do you do much marking? You know,
Oh,
sometimes we
sure.
see people
Sure,
all
sure.
marked up, and
The surgery procedure is the most important one. The design is the most important one.
Sure.
So usually before the operation, on the day of the operation, so we will mark what we will do to the patient. As I think it's the most important one. Yeah. So
Okay.
we have to design it based on the patient condition. So how much is the excess of the skin? So how we will perform it, and I think it's most important one that we have to do it.
Sure.
And after that, usually we will confirm it when the patient is on the general anesthesia or on the operating theater. So we have to make sure our design is correct. Oh, so this one is the measurement. And I think the measurement is a very important one in the plastic surgery.
Across countries that undertake this sort of surgery, there will always be a percentage of surgeries that may require revision.
Okay.
So after the surgery has happened and the swelling has subsided, maybe there is some evident skin laxity, or maybe the patient is not as happy with the result. Is that something that all surgeons in Bali would encounter?
I think it's in every part of the world. Yeah, the revision is like a specific like a risk of the operation. So every procedure they have their own risk of the revision rate. So as you said that maybe in Australia like 2%. So yeah, in every country that have their own revision. So I think it's not there are no like 100% successful like no revision at all. So some patient can develop. We have to perform like revision.
Sure.
I think it's not only in Indonesia, not only in Australia, but all of part of the world is have their revision.
And how soon after surgery, if someone doesn't feel their expectations have been met, would you suggest that they contact the surgeon to discuss revision? Should they wait 6 months to see the full results, or
Okay.
should they maybe contact sooner?
So I think we have to make sure of the condition. So usually the best way is to consult to the surgeon. So usually it depends on the procedure that they done. So yeah, so before the consult the surgeon, so you can contact the administration. So first, so like inform the what is the latest condition, so you can send us a picture of it. And after we decided that, oh, this one is the final result, so we need like a revision. So if we visit patient cannot come here, so we can provide also the teleconsultation.
Excellent. Good answer. Would you suggest that the patient definitely return to their original surgeon rather than seeking out
Yeah, I
an
think
alternative surgeon?
yeah, I think the first time that the first thing that you have to do is to consult to your original surgeon, because the only one that know what is the procedure that done is your original surgeon. So they will know what they can do to revise to make optimal result to the patient.
Excellent. What happens if something goes wrong? In the very rare case that during surgery there is something unforeseen that happens, does BMIC Nusa Dua have a high care or intensive care unit? And along with that, people may worry about blood supplies, available blood for blood transfusions in Bali. Do you know anything about that and what that might look like for people?
Okay, so actually, every procedure has their own risk, right?
Yes.
A minor procedure or major procedure. So we every procedure have their own risk, and so for the emergency in here, so we are a plastic surgeon team here. So and also we also provided high intensive anesthesiologist care here. We have like 24 wards and also five intensive care unit here with also the ventilator. So to make sure that everything is in a good condition during the operation and after the operation. If is it something like an emergency after the operation, so we can perform it here, and also they can do like intensive care here also. And we also provided it depends on the patient condition, so if they needed maybe there a loss of blood after the operation, because it's one of the risks also after the operation, we can also provide there is a blood supplies, yes, but it's the most important one, so it's before the operation. So we have to we do here is through screening for the patient condition, what is the medical condition of patient, with the plastic surgeon and also the anesthesiologist to make sure that everything is good. But sometimes after we screening and the patient is a good candidate, but something can happen also.
Of course,
yeah.
yes.
And but yeah, we also provided the intensive care unit here, and also all of the emergency care that can be provided for the patient to get the optimal result.
Is it a long time between consultation and surgery with yourself, or is it, can people maybe only wait 6 months before surgery? So when they have the consultation and then the booking,
Okay.
maybe only 6 months or maybe sooner?
I think it's depend. Yeah, depend. It's not like after the teleconsultation, maybe after 6 months, we can book the operation or not. But it's depend on the schedule of the surgeon and also the schedule of the patient also. So we make sure that everything is okay and all right. It depends. Sometimes it can sooner, or if is it there are no available schedule, so we can move it later.
Sure.
But we have to make sure that we agree with the schedule based on the surgeon and also for the patient. So because of like Ozempic is quite a popular drugs lately. I think a lot of patients came with that and look like a lot of weight loss. Yeah. But the most important one, especially if they want to undergo, because of the weight loss, sometimes there is a skin excess that need to be repaired. Especially, usually the patient come with the excess of the laxity of the abdomen and also the arm.
Yes,
Yeah.
yes, arms, of course,
Yeah.
yes.
Yeah, the most important one that is to make sure that the weight is the final weight. So it's not in the period of the reducing the weight, because sometimes if we just perform the procedure but it's not the final weight, so the excess of the skin can
Continue on.
continuing on.
Okay.
So usually we check of the patient and ask the patient, is it how much is your weight? Yeah, is it constant for like 6 months? Is it constant? Like maybe for this month is 50 and 6 months is also 50. So the constant, if the weight is constant, so I think it's we can perform it if there is a skin excess. But if the weight is not constant, yeah, so it's up and down
Yes.
like that. So maybe we prefer to wait because we are afraid that the result is not as good as
Could be.
yeah could be.
Does the skin, after that sort of weight loss, does some of the skin repair? Like,
Some patient, if the weight loss is not that much, usually after we gradually decrease the weight, so the skin excess is not as much as that.
okay.
Yeah, so it's not needed to do the repairing surgery or the removal of the skin. But in some patient, uh, after the usually in the massive weight loss is usually it needed the surgery because especially if the weight loss is very fast. Yeah.
Do you encourage men to come? Because I have many men followers.
Okay.
Encourage men to come?
So I think it's not only the problem for a woman. Yeah. So we have as a man also we can we expect ourselves to be the best version of ourselves.
Correct.
So lately also the lot of men come here and also usually majority doing like a face and neck lift.
Oh, good.
Yes.
Oh, really?
Yeah, and also sometime of the patient like gynecomastia operation, something like that.
So I think it's a very good opportunity now for people to have close to home professional expertise and great outcomes. So thank you so much for your time.
You're welcome.
Very appreciate. Very
Nice
much
to meet you.
appreciate it. That was a discussion, a fabulous discussion with Dr. Wara here at BMIC, and I'm very grateful for the time that the entire staff has given me today. Highly recommend that you come out to BMIC if you are interested in a consultation.